Offering my humble pranams at Bhagwan's lotus feet. Distinguished audience, very good morning to all. It gives me great pleasure to introduce the first speaker of this session, none other than Dr. SSR Kumar Challa. He is proud alumnus of Sri Sathya Sai Institute of Higher Learning. He joined in the first batch of 5-year integrated program in the year 1982 and completed his masters in the year 1987. Later, he obtained his PhD in the year 1990 from the Sri Sathya Sai Institute of Higher Learning under the able guidance of Professor N.R. Krishnaswamy. Later, he pursued his postdoctoral studies at Max Planck Institute for Biochemistry. His areas of interest: nanodiagnostics and biomaterials. He founded 3 startups: Xheme Inc., Millifluidia, and Magnano Technology. He served as director for nano fabrications and nanomaterials. Later, he served as managing director at Harvard University IMAX Roland Institute of Science. Currently, he is serving as president for Quantum Technology Group and also is president and CSO for Xheme Inc. Currently, he is working on developing composites for the blood storage. He edited 2 journals and served several book series in the field of nanotechnology. He served as editor-in-chief for nanotechnology reviews. He authored and co-authored more than 70 scientific publications in the peer-reviewed journals. He had 15 patents. He received millions of dollars for his research grant from the prestigious institutions like National Institute of Health. Till date, he had trained 7 postdocs and 10 doctoral students. He had organized and presided over the 2 symposium at American Chemical Society at San Francisco in the year 2017. He served as a member of NIH review panel on several occasions. He won Nano 50 awards in the year 2006. With this brief introduction, I would like to invite Dr. SSR Kumar Challa to share his wisdom with all of us. Sairam.
Good morning, everyone. Hopefully you can hear me. It's actually challenging, pretty challenging, I would say, to talk to an empty screen. Nevertheless, it's a wonderful opportunity to be back. I feel as if I'm in Perthi. It kind of takes you to a different I would say a stratosphere every time I visit Prashantanilayam. So I'm setting myself in my mind that I'm here in Prashantanilayam and I have a wonderful opportunity to interact with the students and my teachers and everyone else who is able to listen to me today. With that, I want to say especially many, many thanks to the organizers of this wonderful conference, talking about the latest discoveries, latest scientific research that's going on around the world in chemical sciences. I want to approach this in a slightly different fashion. I'm sure you have had wonderful speakers talking about some of the greatest advances that are being made in chemical sciences. What I would like to do in the 45 minutes time that I have is actually present to you 3 facets of scientific research, 3 facets of any meaningful discoveries that happens in any field, and particularly so in chemical sciences. So what are these 3 different facets of a creative scientific discovery? And to me, the most important one is, what is the global challenge that we address with the research project that we undertake? And the second important aspect is, what kind of scientific rigor with which we undertake these projects? And finally, and I think equally importantly, is the human element in this whole endeavor. So what I would like to do is give you examples from my own work for the last 2-3 decades in chemical sciences, broadly speaking, but more particularly in nanomaterials, work that I had the wonderful opportunity to carry out. And I wanted to distill out the research discoveries that we have been able to make as a team and tell the story in terms of these three facets of the creative discoveries in chemical sciences. So with that, I wanted to start from delineating some of the major global challenges that we are facing today. And these, not in any particular order, as you can see, are energy, obviously, huge demand for energy, and that's only going to increase as we move forward with the increase in the population. There is also an increase in energy demand. And obviously, with increase in energy demand, we also see a deleterious effect on the environment. So that's a major challenge as well. In addition to these two, there are challenges in terms of requiring depleting water resources, the attention that we need to pay on those, and grappling with variety of diseases that we are aware of today, and probably the new diseases that may come tomorrow or at any time. I think the COVID-19 has taught us that we need to be ever vigilant about protecting ourselves from varieties of these diseases. That's a major challenge. Now, in addition to that, another major challenge is food scarcity. It's really surprising that even though we are in the year 2021, the food scarcity is only becoming worse and worse day by day. And the scientific research needs to address that global challenge as well. Now, in addition to these specific global challenges I mentioned, there are also challenges in terms of education, challenges in terms of not having the ability to provide education to every child in the world. There is a challenge of increase in population. There is a challenge of not able to meet the democratic norms in all the countries in this world. There is a challenge of poverty. There is a challenge of terrorism, war. We could think of many others as well. But I just wanted to bring to your attention that the scientific discoveries are the latest research that we hear in chemical sciences is not really completely appreciated unless we see it from the vision of the global challenges that we face today. Now, to me, I've been focusing on two major global challenges for the last 2 decades. One is the disease aspect, how technologies and chemical sciences can help in disease diagnosis and treatment. That was one of my passionate areas of research. And the other is energy. So I've also had the wonderful opportunity to look at various aspects by which one could meet the future demand of energy using nanotechnologies. More recently, my passion has been towards another very important global challenge not many people talk about is inequality. And the inequality is becoming such an adverse impact, creating such an adverse impact in everything that we do today, whether it's in the research that we undertake or whether it is in the lifestyle that we operate today. In every aspect of our life, we see the deleterious impact of inequality, whether it's wealth disparity that is really breaking down the barriers today. I mean, if you look at it, globally speaking, 20% of global wealth is owned by top 1% of the people. And if you look at the wealth increase over the 4 decades, the top 0.001% wealth has gone up by 7-fold, whereas the majority, 80% of the population's wealth either remains stagnant or has actually gone down. And there is racial divide. There is also gender inequality. All these aspects are providing us an opportunity to deal with these situations. And the science is an approach that could help us to meet this global challenge of inequality. And how do you do that? And what are the impacts of this inequality on the research that we undertake today? And what you see here is a global map. And you can see that the global map is completely skewed. And it is more skewed towards the northern hemisphere compared to the southern hemisphere. So what this map tells you is the inequality in the scientific research output that's happening in this world today. This inequality is so obvious that most of the research output is, you can see, from the northern hemisphere, and the rest of the southern hemisphere completely lags behind in research output. And that is because of the inequality in terms of the wealth distribution, inequality in terms of the infrastructure that is necessary for the research to be carried out, inequality in terms of the capability of researchers that are available to undertake the research. In every aspect, you can see the inequality in scientific research as well. And this, I'm pretty sure, translates equally in terms of inequality in chemical science research. But the good news is that we have wonderful examples of researchers who have overcome this inequality in a very, very inspiring way. Starting with, I've given you few examples of Nobel Prize winners who have literally risen from the poverty to attain the highest that we can imagine in scientific research. Starting with Alfred Nobel, who introduced the Nobel Prize. He himself came from poverty.
Sairam sir, sorry to interrupt you. Your presentation is not on, sir. We are not able to see your presentation.
Oh, okay, I'm sorry. Let's see. Do you see my screen?
Not yet, sir.
Not yet, okay. I wonder what's going on. Okay, let's see now.
Yes, sir, we see your screen now.
Oh, you see it? Okay. Yeah. So first of all, my apologies. I didn't realize that you were not able to see the screen. But yeah, let's move on since we don't have too much time. So coming back to the good news about this inequality, as you can see, I've just wanted to share with you a few examples of the Nobel laureates who have attained the highest in the scientific research overcoming this inequality. The examples that I show you here are the ones that have literally risen from the poverty and attained the highest in scientific research. This is really inspiring and shows us that there are ways to overcome this inequality. So what I want to show you in my presentation is a story of 3 molecules that I have had the opportunity to investigate, study, and look at the potential ways they can solve a couple of global challenges. And with these stories, I'm hoping that I can share with you the 3 important facets that I was mentioning to you about the scientific discovery, which are, number 1, primarily the scientific global challenges, how the science can address the global challenges that we talked about. And the second facet, it's worth repeating, is the scientific rigor or the approach that you undertake in these projects. And the third element is the human element. What are the various challenges that we face as researchers while undertaking this project? I hope to convey these 3 elements through the story of 3 molecules I had the opportunity to investigate. Now, these 3 molecules that I want to talk about are, the very first one is LHRH, which is the luteinizing hormone and releasing hormone. This is a natural hormone that is produced by hypothalamus in our brain, and it has several important applications, to put it very simply. But one of the things that really is important for my story is that it is used, it can be used for cancer diagnosis and therapy. I will share with you more details as we move along. The second molecule that I want to share with you today broadly can be classified as programmable permanent magnets. These are, again, molecular magnets. There are a variety of them. And I'll share with you in this story about these particular class of molecules, how we can manipulate them, again, in order to meet one of the global challenges. And finally, the third molecule that I want to talk to you all about, again, a class of molecule. These are enzyme mimicking metal oxide nanomaterials. These are special classes of metal oxide nanoparticles that behave as enzymes. Now, I hope with these 3 stories based on these 3 molecules, I hope to convince you that there are human elements in scientific discovery that are as important as trying to address a global challenge with as much scientific rigor as possible. So let's start with the very first story, the story of LHRH, the luteinizing hormone and releasing hormone. What is really fascinating about this LHRH is that even though it is produced in the hypothalamus, it has receptors in variety of cancers, both primary tumors as well as metastatic tumors. Now, as you can see in this particular slide, especially the one in red color, you can see there are at least top 10 leading cancers have on their cancerous cells receptors for LHRH. So what it means is you can utilize LHRH as a targeting agent to target majority of the primary tumors as well as the metastatic cancer cells. Other very interesting bit of information that's really helpful for us to understand why the research is important is if you look at the 5-year survival rate and compare the 5 years of diagnosis, you can see that the patients with distant metastasis, the survival rate is really abysmal. It's pretty low, less than 40%. Whereas if you compare that with the patients with localized disease or the primary tumors, the survival rate is actually pretty high. Now, what this tells us is that there is an urgent need. This is a global challenge, right? So there is an urgent need to address both diagnosis and therapy of metastatic tumor cells. So this is where my favorite molecule, one of my favorite molecules, luteinizing hormone and releasing hormone, is what we zeroed in on. I'm not a cancer specialist. I'm a chemist, as you all know. But I had the wonderful opportunity to collaborate with a large group of cancer specialists, medical professionals, material scientists from different laboratories and different universities. And over a period of 4 to 5 years, we published a lot, of course. But then I think what really struck me was the lessons that we have learned in this journey, in this story of LHRH. So very simply speaking, all that we did was we wanted to develop an approach to detect metastatic tumor cells as early as possible, as specifically as possible, and as small lesion as possible. Those were our goals. At that time when we started this project, this was one of the major challenges that the scientists, especially the chemists and nanomaterial scientists, were trying to work hard to find a solution. So in this part of the story, the human element is really important. The human element is, as you can see, these are some of my wonderful collaborators, and I give all the credit to them. Without them, I don't think we would have really accomplished what we set out to do. Now, it all appears when I share with you all the scientific details in these publications. It appears, oh my God, yeah, it's wonderful research and very inspiring outcome, fantastic set of publications, but that's only a part of the story. I think what is really missed out in these presentations is the human element. And I also want to bring out to you the third global challenge that I was interested in pretty recently, the inequality. So what I want to bring it out to you in this particular slide is the challenges that we faced as a group in developing this project and bringing it to a logical conclusion. Now, instead of specifically naming any names here, what I can tell you over a period of 4 to 5 years is we faced all the challenges or different aspects of inequality that I talked about. You can imagine these inequalities include, and sometimes probably you're surprised, how can some of the best laboratories in the country, in US and in the world, can face these challenges. But the fact of the matter is, it's true. So these groups that are coming from, as you can see, different universities, as collectively, we faced the wealth disparities. We faced gender inequality. We faced politics, so to say, in a very simple way. But these are the realities of scientists today. And I want all of us to remember that this is a reality, this is a human element that we will all face. And the key is, how do we succeed? How do we overcome inequality? And this is where the concept that I've been working on with social scientists And the concept is called, what can I do with what I have? And you will see, and hopefully I can convey to you through these three important stories, how the concept of what can I do with what I have is demonstrated. So having said that, let's now dive deep into the other two elements. The other two elements are, what is the global challenge that we are addressing on this in this story? And what is the kind of scientific rigor that involves in making this story a successful story? So as I said in my background slides, that the global challenge is, how do you detect micrometastatic tumor cells as early and as sensitively as possible? And that's what we try to develop: hyperpolarized MRI contrast agents. And this is the first time a targeted MRI contrast agents concept of targeted MRI contrast agents was ever developed. And we were very fortunate as a team. We overcame a lot of these inequalities that I mentioned to you, a lot of human elements, human challenges that you would face when you're working as a team. We overcome those and finally achieved the goal that we set forth to. So I just want to give you an overview of the scientific aspects of this particular project. So let's call this project as Molecular Magnetic Resonance Imaging for Sensitive and Specific Detection of Lung Metastases. So if you want to get all the important details, several publications are there, but I just want to allude you to one particular one. This was published in Proceedings of National Academy of Sciences. So in this particular case, what we did was we took the LHRH bound iron oxide nanoparticles, very simple system, and then we injected them into mice where the prostate tumor models were developed. So we looked at both the primary prostate tumor cell detection as well as the metastatic tumor cells in lung. So once you inject this, obviously you can see the part B is we anticipated the luteinizing hormone and releasing hormone to go and latch onto the LHRH receptor, and thereby through endocytosis mechanism, the cell wall opens up and the iron oxide nanoparticles are delivered into the metastatic cancer cells. And then we observed those by developing, moving away from the standard proton-based magnetic resonance imaging to hyperpolarized helium-3 based magnetic resonance imaging. Now, what is it that we wanted to accomplish in this set of experiments? Till then, what was very popular were CT scans. CT scans were very popular because you could get really pretty high sensitivity, sub-millimeter detection of metastatic tumor cells or the primary tumor cells. But the problem with the CT scan approach is it's non-specific. You cannot really differentiate if the sub-millimeter lesions were the tumor or they're benign. On the other hand, the PET technique, positron emission tomography technique, is also a wonderful technique. It's very specific. You can differentiate between the benign cells versus the tumor cells. But on the other hand, the problem is the resolution is pretty high, pretty low there. So what we hope to accomplish in this particular case was to see if we can have the hyperpolarized magnetic resonance imaging, which would help us to overcome the two challenges, both with the CT as well as the PET. And the results I quickly want to share with you shows, without going to the details of it, that we could detect about 300 micrometer size metastatic tumor cells in lung. And this, I would say, is the smallest metastatic tumor lesion that has ever been seen using this particular technique. Now, what is really fascinating is this not only demonstrates the ability to diagnose metastatic tumor cells, but this provides an opportunity. The results that have been obtained demonstrate a pathway to really monitor, for example, a movement of a cell moving from a primary tumor site all the way to different sites as metastatic tumor cells by latching on to the LHRH iron oxide nanoparticles. That's what is the impact of the research outcome from these studies. So hopefully I have given you all the three elements of this particular discovery of ability to target agents that enable us to detect specifically and sensitively metastatic tumor cells. And as a part of this particular story, some of our team members moved away from diagnosis to therapy. Now, this therapy was achieved again in a very interesting fashion. So what this particular group did was they combined the LHRH to Lytic Peptide. The Lytic Peptides are a unique class of peptides, highly effective in destroying the tumor cells. So what they have demonstrated, in fact, this study has become so important in developing the cancer therapeutics that a company was formed. And this company is called Esperance Pharmaceuticals. They are in the final stages, final clinical trials to bring this drug to the market. And this is very fascinating. Again, the central hero in this particular story is the luteinizing hormone and releasing hormone. So what they did was they bound the Lytic peptide to the targeting ligand, which is the LHRH, and then they have demonstrated very successfully that it specifically targets the metastatic tumor cells and destroys them. This is a very, very important discovery that happened, again, starting from the story that we wanted to begin with, which is the LHRH story. So let's move on to the second story that I wanted to share with you today. While the first story primarily involves the human element of well-established researchers, as you can see in the images that I've shared with my collaborators, they're all very well-established team members. But in the second story about this programmable permanent magnets, that's the second story, I want to share with you some of the wonderful undergraduate students and postdoctoral researchers that I had an opportunity to work with. And this is a story that brings out a different kind of human element, a different global challenge that the research outcomes we hope to address, and then finally, a different set of scientific rigor this story tells us. Now, I want to introduce you to some of these graduate students and the graduate students and postdoctoral researchers, as all of us know, are the backbone for any of these scientific discoveries. They come with so much of passion. They come with so much of zeal to learn. They come with so much of ability to dedicate their time in pursuing a project of their interest. And some of these, I didn't have a chance to get photographs of everyone, but some of these graduate students really made dramatic changes to the research projects that we undertook. In spite of all the challenges that you face financial challenges. It's not a hunky-dory lifestyle that the grad students and postdoctoral researchers deal. They have to deal with financial situations. They have to deal with the wealth inequality that I talked about, right? So they have to deal with the gender inequality. They have to deal with the racial inequalities. These are not the stories that we read in newspaper. No, these are the real life experiences that I just want all of us to take home with us. It's so important. And one of the reasons why I keep stressing on the human elements is when we reach a level of affecting change, all of us have the responsibility to be aware of these inequalities and do our very best to prevent or minimize these inequalities. And that's the reason why, to me, it's very important that we work simultaneously on this humane problem, humane global challenge, while we also continue to work with scientific rigor on solving some of the global challenges, global scientific challenges. So again, yeah, without naming the names, these are the elements, these are the challenges the graduate students have faced. And I want to share with you this particular story in dedication to them. So what are these programmable permanent magnets? And what is the global challenge? Again, remember, the major global challenge is all about disease, but the underlying that global challenge is how do you develop drug delivery systems, controlled drug delivery systems that can deliver time and dose dependent drugs. That's the challenge that this set of wonderful researchers have started to work on and demonstrated through their sheer perseverance that you could be very creative and you can, through scientific rigor, achieve the goal that you set forth. So a brief background. What do we mean by the permanent magnetism in these molecules? This particular story of molecules demonstrating permanent magnetism. So we will all be not surprised, hopefully, that the gold nanoparticles show paramagnetism, right? And some of them, depending on the nature of the ligands and the size, especially primarily less than 2 nanometers in size, these nanoparticles have known to show blocking temperature sometimes more than 300 K, so which are like room temperature permanent magnets, and demonstrate the magnetic properties that allow them to utilize as permanent magnets in spite of being molecular in nature. And they have very interesting properties that enable us to utilize them in developing drug delivery systems. So what we did, again, this is just an example. While it is known that the thiol-stabilized gold nanoparticles demonstrate paramagnetism and also permanent magnetism, but what is not known is how do you tailor them? How do you manipulate these surface architectures in such a way that you can manipulate the magnetic properties of these molecules? And that is the problem that we started working on. Again, the reason is if we are able to tailor make or manipulate the magnetic properties of these molecular magnets, then we have an ability to manipulate their magnetism so that we can develop the controlled drug delivery systems that we need to solve many of the challenges that I talked about. So what we have seen what we are seeing rather in this particular slide is that you are increasing the surface functionalization as you move from the molecule A to molecule D. But what is really fascinating is that we were able to observe changes in the magnetic properties of these materials as we increase the chain length of these iron oxide core gold shell nanoparticles. Now, with the increase in the surface functionalization, we have demonstrated that you can manipulate the magnetic properties of these materials. And again, without going into the details, what is really obvious, you can read through several publications associated with this concept that we developed. You can see that the gold nanoshells that are on one side have a core of iron oxide nanoparticles, and on the surface you have thiol-capped a surface functionalization of different chain length. And you can see with the increase in the chain length, you can increase the magnetism of these, moving from paramagnetism all the way to permanent magnetism. Now, how do we take advantage of these systems? Now, here we demonstrate, this is again a very interesting example of cobalt core gold shell nanomaterials incorporated within the polymeric shell prepared based on the layer by layer self-assembly approach. And these are all polyelectrolyte layers, as you can see. So when you synthesize finally, what we developed were the empty core. These are donut-shaped architecture. You can see the empty core, but then the shell has cobalt core gold shell nanoparticles encapsulated within the polymeric shell, right? Now, why did we develop these architecture? Remember, our main goal is always, how do we manipulate the magnetic properties of these molecules or materials? And then how do we incorporate the methodology of manipulating the magnetic properties in order to develop controlled drug delivery systems? That has always been our main goal. Now, as you can see here, we wanted to demonstrate the proof of concept as to how you can control magnetically the movement of the drug as a concept here now from external source to the internal empty core shell. Now, as you can see from the images here, you have the fluorescent solution entering into the empty core of these materials when you apply an oscillating magnetic field. And when we stop the application of the oscillating magnetic field, then the movement of the fluorescent liquid inside the shell stops. So this is a reproducible system that allows, in a controlled fashion, movement of the material, movement of the solution from external to the empty core, or if you have the ability to have the solution inside the empty core, it would come out from the empty core to the external environment. What we've also demonstrated is that on one side, you can manipulate the magnetic properties of these materials by varying the chain length of conjugation, but we could also manipulate the materials by varying the shell size. If you start with different shell thicknesses, starting from 1 to 10 nanometers in thickness, you could actually manipulate the magnetic properties of these materials. So just to summarize what we have learned so far is that we have an approach to manipulate the magnetic properties or tailor-make the magnetic properties of these materials in a very controlled fashion. And we've also seen that such controlled manipulation of magnetic materials enable us to develop time and dose dependent drug delivery systems. Now we took this up to a very interesting level, and we wanted to prove this in a specific application. And what we came up with was a very unique design. This is, again, it's in collaboration with my collaborators. As you can see in this particular slide, we came up with a design. They're called quantum rattles. And these quantum rattles are basically the gold-silica magnetic quantum rattles. As you can see on the left-hand side, you have an empty core consisting of gold nanoparticles, followed by a silica shell. And the silica shell, as you can see in the insert, the silica shell has smaller size gold nanoparticles. So at the end of the preparation of this particular construct, what you would see are two different sizes of gold nanoparticles. One size is less than 2 nanometers encapsulated in the silica shell. And then you have gold nanoparticles, about 6 nanometers, inside the silica shell. And you can also have the drug that needs to be delivered, in this particular case, Taxol, that was encapsulated along with the gold nanoparticles. Now, why is this construct so important? Why the design element is very important? And how does that really affect both the controlled delivery of the drug as well as sensitive and early detection of the metastatic tumor cells or the primary tumor cell? So this particular example, we applied it to detect the primary tumors in colon cancer. And as you can see from my studies, the detection limits are, again, in sub-millimeter size. I'm realizing I think I'm already sleepy. It's going to be 11:30 in the night. So it's almost sub-millimeter size lesions can be detected using this approach. Now the other unique aspect is this offers a multimodal imaging methodology. So you could use the near-infrared photonics based on the gold nanoparticles, and you could also use the magnetism arising out of the less than 2 nanometer gold nanoparticles that are encapsulated within the silica shell. Now, as you know, direct binding of drug molecules to gold nanoparticles have several challenges in situ experiments. So in this particular construct, the gold nanoparticles are not directly exposed to the cellular environment. Therefore, the challenges currently faced by approach wherein you utilize the gold nanoparticle are overcome with this particular construct. So I want to move on to the next stage in manipulating the magnetic properties of these unique classes of molecules. Then the story continues. Again, when I say about the scientific rigor, what you can see is there is a progression in terms of the sensitivity of applications that we are developing as we move forward. You're able to fine-tune the materials better and better in order to offer a performance that ultimately will give us the result that we are looking for. That's the goal. So again, we started with the gold, thiol stabilized gold nanoparticles, and we said that we can manipulate the magnetic properties of those materials by manipulating the shell as well as manipulating the conjugation, the length of the conjugation on the gold nanoparticles. And then we said such materials, constructs, can be utilized for multimodal imaging and also for therapeutic applications. And in one particular case, we demonstrated for colon cancer diagnosis and therapy. Now, from there, we moved on to really to understand how these molecules can further be manipulated. I'm using the word manipulation because it's all about tailor making, tinkering around the properties, tinkering around the structure. This is what is called as structure property relationships, basically. So the idea is, okay, how precisely you can make this material so that you create an advantage for yourself in the applications that you're looking for. So as you move on, the chemically induced permanent magnetism, that's what is the technical term that's used for these thiol stabilized small size metallic nanoparticles, the magnetism in these structures, right? So we moved on to looking at the magnetism broadening out from gold to silver and copper nanoparticles. And then further, we wanted to see how precisely you can manipulate these by controlling the number of atoms in any particular metallic element. So what we have demonstrated, again, just in one slide, is that as you change the number of gold atoms in a particular cluster, you can actually change the magnetism. So this is, again, a very interesting piece of work that showed us that you can manipulate the chemically induced magnetism in atomically precise gold clusters. So hopefully I've given you from the second story about the permanent magnetic molecules, how you can manipulate the magnetic properties of them in order to develop control drug delivery systems and the multimodal imaging systems. Now, finally, I want to share with you the third story. And the third story, again, I hope that will teach us a different aspect of the three critical elements that I talked to you about the discoveries that one could make in chemical sciences. Now, in this particular story, the human element comes from a completely different direction. On one side, in this particular project, you have a wonderful set of collaborators that share this story with me. And I just want to introduce them to you. Professor Tamir Kanius, he is a blood biology specialist from the Vitaland Research Institute. And then you have plastics engineering professionals, polymer coating professionals, and pharmacology professionals. The idea is, how can we develop plastics with regenerative antioxidant properties, right? And when we talk about antioxidant properties, the best examples are always going to be enzymes,
Sir.
right? Yeah.
So we have 5 more minutes to conclude, sir.
Oh, sure. So what we did was we looked at the enzymes that are very well-known enzymes, and we zeroed in on 2 of them, which are the superoxide dismutase and catalase. And we developed metal oxide nanoparticles. I don't want to go into the structure of it. These metal oxide nanoparticles have switching oxidation systems, +3 and +4. And having that ability to switch the oxidation state from +3 to +4 seamlessly, we are developing a regenerative antioxidant. And we call these particular types of metal oxide nanoparticles are Xheme Nano. And where are we applying them? We are applying them to increase the shelf life of blood. And as you know, the challenges faced by the storage of blood. There is a shortage of 30 million units globally, and about 18 million units of blood is wasted due to expired shelf life. And what we have seen is that currently the shelf life of blood and blood products, that's limited depending on the type of the blood component, whether it's a platelet or RBC or the whole blood. It's about 5 to 42 days. And what we are trying to develop are the plastics encapsulated with these Xheme Nano. And we believe these have the ability to increase the shelf life. And these are again based on the wonderful, surprising results that we have received, we have seen in the case of preserving the red blood cells in stored whole rat blood. And as you can see from this data, that we can actually increase the shelf life of blood by 60 to 70% more by using these materials. These are again next set of results. And finally, I just want to share with you my favorite molecule that really taught me all the three elements of scientific endeavor. And this is the molecule with which I started my PhD in Prashanthanilium. And it is so, lo and behold, all that I did was took this molecule, took it in a petri dish, exposed it to the beautiful sunlight of Prashanthanilium, and that's how my journey began. And this is again the foundation for all that happened and continue to happen in my scientific research. And hopefully I shared with you there's three stories, and the three stories taught me that collaborations are really important. And I'm very fortunate personally for having wonderful collaboration. And hopefully I conveyed to you the key elements that are really important in scientific discoveries. One is to identify a global challenge that we can be passionate about, applying the scientific rigor, and thinking outside the box to solve a problem sometimes we think are impossible to solve. And finally, let's constantly ask ourselves, what can I do with what I have? Let's not think about what challenges we have, what problems we are going to be facing, but ask ourselves, what can I do with what I have? And I'm pretty sure we will all be successful the moment we have this mindset. With that, I want to thank all of you for patiently listening to me. Hopefully, my sleepy presentation has not put you to sleep. It's 11:30 here. But again, thank you so much. Thanks again for the organizers for this wonderful opportunity.
Sairam sir,
Sairam.
thank you for that beautiful talk. I have a very quick question for you, sir, from the student here. What is the mechanism involved in detection of diseases with LHRH samples?
Yeah, 1 minute, I'm trying to, I want to look at the video. Yeah, hopefully. Okay, I'm sorry, could you repeat that question?
What mechanisms are involved in detection of diseases with LHRH samples?
Yeah, okay. Yeah, wonderful. It's a great question. Yeah, thank you so much. So the LHRH has receptors on both primary tumor as well as the metastatic tumor cells. So the LHRH latches on to the receptors, goes through the endocytosis mechanism to open the cell wall of these tumor cells, and then allows whatever is attached to the LHRH to go into the cell.
And the quick question, sir, the
Sure.
role of sulfur in thiol-capped AUNPs, gold nanoparticles. Can we replace the sulfur with any other heteroatom?
Yeah, that's a great question. Yeah, so there are publications that demonstrate that there are in cases, for example, when you have amine groups, they do see some magnetism. But again, it's not, the answer is not really as simple as I'm trying to make it. But in the end, yeah, what is really important is to have the coordination of the electrons, either through the sulfur or nitrogen that interacts with the gold atom or the metallic element.
So due to want of time, we will forward the other questions to you by mail and await your responses there. And we
Sure, absolutely.
And we thank you for taking your time out at this late hour in the night and sharing your wisdom and experience with all of us. We look forward to many more such opportunities of hearing you, sir, and so that we can learn from your experience and wisdom. Saram, sir.
Thank you, Sairam.